Today, we're going to dive into a concept that could completely reshape our relationship with healthcare. It's a really fascinating idea that started from just a single sketch. It's called the G2 Universal Patient Watch Monitor, and it imagines a future where your doctor is, well, in a sense, always with you. So just think about the watch you might be wearing right now. It probably tracks your steps, maybe your heart rate, but what if it was the central hub for your entire healthcare journey? I'm talking from your morning jog to a hospital stay and all the way through your recovery. That's the huge idea we're going to unpack. And this is where it all started. The whole concept comes from this one hand-drawn diagram. It's pretty amazing, right? It's basically a blueprint for a totally integrated patient monitoring system. And just look at the ambition here. This isn't just about some new gadget. It's about connecting you, your doctor, and the hospital into one single seamless loop of information. So let's get into the core idea here, the connected patient. This entire system, this whole vision, it starts and ends with you. It puts your daily life and your data right at the very center of your own healthcare. Okay, so how would this thing even work in the real world? Let's trace the flow of data, from the very second it's captured on your wrist to the moment it actually lands in your medical record. All right, so it all kicks off with the watch. It's capturing your biometrics in real time. That data then gets sent securely straight to the hospital. And from there, the system creates something the sketch calls a Hospital Biometric Profile. Now, this is the really crucial part. This isn't just a snapshot from your annual checkup. We're talking about a living, breathing health profile that's being updated literally moment by moment. Okay, so you've got this constant stream of data flowing into the hospital system, building this incredibly detailed biometric profile. But, data is only useful if someone actually does something with it. So now what? What happens next? This is where we flip to the other side of the equation, the doctor's dashboard. This is where all that raw data gets turned into a really powerful tool, shifting healthcare from being reactive to something truly proactive. I mean, just imagine how this changes a doctor's entire day. Instead of waiting for a patient to call and report a problem, they're getting real-time alerts. From this one screen, they can manage prescriptions, set recovery goals, track your progress, and even start up a consultation. All of it powered by the continuous data coming from your watch. The whole doctor-patient relationship just totally transforms, right? It goes from these once-in-a-while appointments to a continuous, collaborative partnership. But the vision here goes way beyond just the biometrics. This system is designed to pull in the entire administrative side of healthcare, creating one truly unified profile for what it calls total patient care. If you look closely at the diagram, the system would also handle all the other stuff: data services, payments, insurance details. It would even have your emergency information right there, ready to go. All of this gets combined to create what the sketch calls a patient recovery profile, which is just a complete holistic view of your entire healthcare journey, from the clinical side to all that paperwork. So when we step back and put all these pieces together, what is the big picture? What kind of future for healthcare is this one little concept really sketching out for us? Ultimately, the vision is this: a seamless, real-time connection between your daily life and your long-term medical care. The wall that usually separates your life outside the hospital from your treatment inside it, well, it basically disappears. It creates one continuous, data-driven conversation about your health. And that kind of leaves us with a really big question, doesn't it? This sketch presents this powerful vision of super efficient, proactive, totally integrated care. But is this the inevitable future of medicine? Or, with all its constant monitoring and data collection, is it maybe a step too far? That's the question this concept leaves us chewing on. Thanks for exploring it with me.